Hey, not sure you needed me to introduce this verbally, but I'm going to anyway. My name is Emily Stone, and my topic is Predictors of Latinx Caregiver Engagement in Adolescent Mental Health Treatment. All right, so here's the problem. So there is statistics by the Center for Disease Control that state that hopelessness and sadness in Latinx adolescents is rising at a larger rate than non-Hispanic whites and African Americans. Additionally, those who are considering suicide and created a plan has also significantly increased. So with this being said, I want to highlight that we need additional research and mental health treatment awareness, accessibility, and caregiver involvement in treatment for the Latinx population. And specifically for me, I thought it was important to bring in caregiver involvement because I think, especially if we're in systems work, that to affect change in the adolescent, we may need to bring in the whole family. So this slide, I'm going to be talking about awareness and accessibility to treatment. So one giant statistic is that 75% of all Latinx teenagers in this one study, both rural and urban, could not identify a single mental health resource. That's a big problem, especially with mental health becoming such a big issue for the Latinx youth in the country. So moving on from that, another study in my research found that yes, there is higher levels of mood disorders and anxiety in Latinx adolescents and significantly less service use. So this is really highlighted in the fact that 75% of them couldn't even name a source. They're also not using the sources, probably because of lack of awareness. So this could have all been attributed by a positive association between years of residence in the U.S. and service use. So what this is basically saying is that the longer they've been here, probably the more acculturated they are, probably the more material and socioeconomic status they have, and awareness of mental health, and possibly even insurance. So that's a big one for getting into mental health treatment. So the next one even says something similar, is that greater caregiver acculturation significantly increased the likelihood that a Latinx youth with internalizing needs would receive mental health services. So that could be all of that over again. Socioeconomic status, insurance, all of that. Parents reporting mental health stigma and barriers related concerns more than other demographics. So this would mean that Latinx parents are showing that they might get a little bit embarrassed. This was a qualitative study, so this is their words. They're embarrassed of mental health diagnosis of their kid. They think their teachers might treat them differently. And additionally, the barriers that they brought up is transportation, lack of resources to even get to treatment, pay for it. The insurance thing comes up. And then next is that parent perception of their child's mental health needs. So this one actually looked into the fact that they really do want to help their kids. They want them to feel better, and they don't want them to be going through depression and feel anxious. Yet their catalyst for change, they believe, is themselves. So the parents themselves and the family, they think that that's what's going to help them the most. And that may be true. And then also mental health services in the United States also value the therapist, where the parents, Latinx parents, may not prefer that relationship to be built the way that it typically does in mental health services. Additionally, they believe that if their child is using substances or doing criminal activity or anything like that, that the only way for them to learn would be to be incarcerated. So this is also a big thing. So regarding mental health and the culture in America is that we believe that it would be more necessary to use mental health services rather than punitive measures. So it's just kind of a difference in belief here. This slide talks a little bit more about participation and engagement of Latinx caregivers. So this first bullet talks about how the more dysfunctional that a family with a more acculturated adolescent believe they are, they presented higher attendance to treatment services. So I think this is a lot to do with the fact that the family is fully aware that their teenager is kind of separating from the family and are more motivated for change than other families in this study. Additionally, participants in one study who filled out a survey in Spanish rather than English participated significantly less in treatment. So this would fall into that acculturation thing where if a Latinx parent filled out the survey in English, that might show a little bit more acculturation to the US culture, meaning they may, again, have more resources, insurance, that sort of thing. The next one says influence of acculturation indicators, perceived economic stress, and anticipated benefits of the program did significantly influence Latinx participation in their child's mental health treatment. So, just similar to what I last said, perceived economic stress and anticipated benefits of the program really do impact whether or not they participate. And then lastly, this one's a little bit more opposite. Lower acculturated Latinx parents had a higher completion rate in treatment than acculturated counterparts. This one, I believe, could be due to the fact that once they finally get engaged and are utilizing services, they have more of a reason to stick with it. But that's just my thoughts on it. Lastly, let's look at this from a lifespan lens. Adolescence is stressful for Latinx families because there's an added pressure of normalizing to a dominant culture, socioeconomic burden for the parents, and feelings of oppression by social institutions by both. And with this all being said, adolescence is already really hard for a teenager to try and find themselves and attaching onto their friends. And this is also going to be a lot different for a Latinx family with parents valuing the family first, whereas teenagers in the US culture may not put the family first and put their friends first. It's common for Latinx families to bring in the extended family members, and in the US culture, Latinx teens might reject that authority and really latch on to more of their friends, and this could be a really scary experience for the entire family. So, just a conclusion to wrap this up. The ability to afford access and continue to participate in mental health treatment requires that the family has the socioeconomic status to acquire it. And many Latinx families work paycheck to paycheck, and the ability to maintain treatment engagement may be too demanding in itself. For parents, this is really tough, and I'm saying that we may need a little bit more resources out there to gain that awareness to help Latinx parents get their children to treatment with their mental health diagnosis rates going up. So overall, that's my paper. Thanks.